Hi, Lena. My name is Sophia from Seneca. How are you?
I'm good. How are you?
I'm great. How can I help you today?
Well, long story short, my husband and I are looking into adopting, and we came across this one child who really took to us, but his profile indicated that he has sickle cell anemia.
Mm-hmm.
And so, as potential candidates for this child, I came here to learn more about what managing this would be like.
Well, first, congratulations. It can be quite a process, I heard.
Yes, thank you.
May I ask what you and your husband do for a living?
Yeah, so I'm a chemical engineer, and my husband is a high school teacher.
Okay. That's nice. I assume that you guys have insurance and things like that to help you pay for all the process and stuff?
Yeah, so we both have OHIP as well as insurance from our workplaces.
Good. It's important because some medications can be expensive and it may not be covered by OHIP.
Right.
So we ask that you be insured just in case your physician prescribes you something outside of it. We know you have some coverage from somewhere else.
Right, that makes sense. I understand.
So going back to talking about sickle cell, I'm happy to provide you as much information as I can, but do you know anything about sickle cell anemia?
So I know that it's genetic. So if my child decides to have their own children, that it'll probably be passed down to them as well.
Yeah. So yeah, you're right. It is genetic. Is there something else?
I also know that it has something to do with abnormal red blood cells, but I guess that's pretty much it.
Yeah, that's pretty much the gist of it. Before I teach you anything further, do you have a specific preference on how you like to be taught?
So in university, I was an audio and visual learner, and I found it helpful to read, to understand, and listen to help connect the dots.
Sounds good. So I'm a talker, so we don't have to worry about that.
Okay.
But I've actually got printed out some information that we can go through together, and you can write on it, take it home, highlight it, share it with your husband if you'd like.
That sounds good. I'm really eager to learn about managing sickle cell because my husband and I really hope to get chosen as this child's parents.
Yeah, that's wonderful to hear how eager you are to learn about it, and it's important that you do if you end up adopting this baby. As mentioned before, I will do my best to answer your questions, and if there's anything I can't answer, I will provide you with someone you can talk to.
Okay, sounds good.
So as you mentioned earlier, sickle cell is related to abnormal blood cells. Our red blood cells have hemoglobin, which is what gives the blood its color, the red color, and it helps us carry oxygen from our lungs throughout our entire body. With sickle cell anemia, the red blood cells are different because it looks like a disc as opposed to a circle, so I'll give you this. And here's just what a normal as opposed to a sickle cell one.
Oh, I see.
Yeah, and you can see that the chains are different as opposed to just being there.
Yeah.
The sickle cell is rigid and sticky, so it can block the blood flow to organs and muscles and tissues. This blockage can lead to areas that have lack of oxygen. So, yeah. Am I making sense so far?
Yeah, I understand. The banana-shaped blood cell is caused because of a lack of... Oh no, the banana-shaped cell causes a lack of blood flow to pretty much everywhere in our bodies.
Yeah,
okay.
right.
Okay.
And this can cause a person to experience pain from the lack of blood flow to their and oxygen to the organs, muscles, and tissues.
Okay. Wow, this sounds really painful and scary, to be honest with you. How is it treated then?
So I understand it can be scary and it can be painful, but there are a few ways you can treat and manage it. Your physician most likely will prescribe a drug called hydroxyurea.
Okay.
This medication has shown to reduce the frequency of these episodes of pain. And the other recommendation is blood transfusion and folic acid dietary supplements. Another option would be that. And since sickle cell may block oxygenation throughout the blood vessel, the transfusion would prohibit this from happening. But here's a package that explains everything about blood transfusions, benefits, risks, and details.
Okay.
I just wanted you to make sure you read this, which is why you should give a transfusion for sickle cell. So normal blood cells carry oxygen throughout the body. This blood cell of the people with sickle cell do not deliver oxygen as well as normal red blood cells do.
Right.
In addition to these cells may change into a sickle shape, which blocks the flow from the blood vessels. When a person with sickle cell has certain complications from this disease, transfusion of normal red blood cells may help deliver oxygen and the body and unblock the blood vessels. See, as you can see, they clump together and then they can block it. Yeah.
Oh, okay.
But here you go, some
Thank
additional
you.
information.
Thank you. Okay. So is there any way to cure sickle cell anemia?
Good question. So research has shown that the only current way to treat it is to go through a stem cell transplant.
Okay.
You can find more information about it online at the Hospital of Sick Kids website
Okay.
that I printed out for you, and you can bring it to your physician if you have more questions about it, since I may not be able to answer your questions and concerns.
Right.
But of course, there's always risk and complications and benefits for it. So
Uh-huh.
you might want to weigh it. Yeah.
Okay, sounds good. So I'll definitely talk to my physician about it if in fact we do choose to do that. So you mentioned the medication that helps with the pain management. Can you tell me more about it?
Yeah, so hydroxyurea helps with stopping the red blood cell from changing into the sickle banana-shaped cell.
Okay.
So it can function like a normal red blood cell and cannot cause the blockages to the organs, muscles, and tissues. Another helpful thing is that it does keep the red blood cell flexible and round so that it can travel more easily through the blood cells.
Okay, so they take this medication to prevent them from experiencing the pain, is that right?
Yeah, so it helps lower the number of pain episodes they may experience.
Oh,
Yeah.
okay. I see. That makes sense.
From what I know, adoption can take a huge toll on parents financially and emotionally.
Mm-hmm.
It is important that you have someone to talk about your feelings, and if you were to get this child, you may find helpful clinics for the support. In downtown Toronto at Princess Margaret Hospital, they have a red blood cell clinic which is dedicated to managing sickle blood cell anemia, and how you can therapeutic ways to manage and what you can do at home. And here's the office hours and the number.
Okay,
Yeah.
thank you. I didn't know there were resources like this in Toronto. Thank you.
No problem. To end the session off, I'd like to lastly talk about the signs and symptoms that you will require to bring your child to see a doctor. I also printed out this copy of this list for you that you can hand out. You can head out. I won't be able to read them all, but if you can get something to bring to your husband. But here I just want to bring your attention to some of it, the key points.
Okay.
So infection, fatigue, and dehydration are possible triggers for pain crisis.
Okay.
You do not use ice packs to treat pain. If she has fever, you should immediately take her to the emergency room.
Okay.
But yeah, that's mostly what you should look out for. If you see these things, you might want to go to the hospital, or if it's less extreme, go to the doctor just to get a regular checkup. Yeah.
Okay, sounds good.
So yeah, you should. So furthermore, if you want, if your child is experiencing pain in their abdomen, chest, bones, or joint, as well as swelling too, in the hands, legs, or feet, you should probably go to the doctor. Do you have any questions about the management of sickle cell anemia? I know it's a lot of information to digest.
It is a lot of information, but I think you answered all of my questions to the best of your ability, and I'll definitely call if I have any questions or concerns.
Of course. If it's not me specifically, there are other nurses that will try their best to help. Don't forget to call the Red Blood Clinic, and they can be able to assist you in any way since they specialize in this stuff.
Right.
Yeah.
Okay, great. This session was extremely informative. Thank you for taking
It was my
the
pleasure.
time.
Thank you.
Thank you.
No problem.